If I ask you to picture what a medical provider looks like, I'm sure that you have some image that pops into your mind. For me, when I picture a medical provider, a white male pops to mind, usually older, with a buttoned up shirt and a tie. But no matter who you pictured, I would venture to guess that you didn't picture someone who looks like this or who looks like this. Yes, these are both medical providers, excellent medical providers. They're both PAs. And I'm going to talk to them today about their unconventional looks in medicine and the reception that they've gotten from both patients and from administration. Hi, it's Michelle with the Medicine Couch. Thank you so much for joining me today, and I think you're really going to enjoy this very interesting discussion with these two wonderful PAs. Don't forget to subscribe and hit that like button and share this video with colleagues who might find this conversation interesting.
Thanks for having me. My name is Tracey Piparo. I am a PA in Central New Jersey, practicing for the past, I got to do math now, 22 years.
One of the things that I wanted to talk about, and I think that people can see, although it's a little difficult with your headphones on, I've seen you in person, and I know that your hair often has a vivid purple color to it. It's shaved on the sides, right? If people can't see, is that correct? Yeah. And you've got some tattoos and things. You like to wear the fun glasses. This is all great, but it doesn't fit the mold, right, of what we think a provider looks like. So I'm curious if you can talk about how this has been for you. Has it been problematic, and how do people receive it, from patients to management to fellow colleagues?
I will say I never had a problem at work, but I will admit that for a long time, it was my own problem. I think I always had a tendency to be a little bit different, but not outwardly. I didn't know how to do it. I got my first tattoo when I was 21, and I put it somewhere where nobody else could see it. And then I got a couple more tattoos, but it was still always, if I put a shirt on and I go to work, nobody's going to see it. And, when I went to get my tattoo on my arm, I remember having a conversation with our friend who is our tattoo artist. And it was like, what are we doing here? Are we doing a whole sleeve, a half sleeve? And I was like, I just want to do like a quarter. And she was like, are you sure? And I was like, yeah, I'm still a little uncomfortable. Okay. Yeah. And then I started thinking, why am I so uncomfortable? And the one day, and it was after having 2 kids, I'm like, I'm just going to put some purple in my hair. All right. I did it. And I still had I never had longer hair. It was always shorter. And then it just got more wild as it went along. I was kind of disappointed today because I totally need to be touched up. So it's not as bright as it usually is. And nobody cared. I went to work that first day and was like, oh, nobody said anything. Great. Then I shaved my head. Nobody said anything. And I think a lot of it was really eye-opening for me. I was like, wow, it's been great. And honestly, when I was a hospitalist, I worked for a private practice. So I had a lot of, unfortunately, the same patients coming back all the time. They were amazing. I had a couple of older females that if I walked in their room and my hair was not done or I needed a root touch-up, they were the first ones to tell me, like, why is your hair not done? Why is the purple not bright? And I'm like, holy moly. I said, you know why? Because I'm too busy coming in here so I can write your orders. None of my bosses have ever said anything, and it's been refreshing. Again, most of the time I'm in some sort of jacket. I do not wear a white coat. I'm in some sort of scrub jacket or whatever at work. So not a lot of people see my arm tattoo. I've got a big tattoo on my thigh, and I wear skirts sometimes. Patients have asked to see it. It's a conversation starter. Yeah. Sometimes you look a little bit different. They may be like, hey, this isn't what I expected. I'm going to talk to you. Sometimes that works in my favor. Sometimes I'm like, oh man, this is not the friend that I wanted. But we've all been there. But I think as long as you do your thing confidently, that comes through in your practice, right? I'm not walking in there like, oh man, I'm so afraid they're going to say something. Just own it. Walk in there and they're going to be like, oh, what's different than a cisgender white male walking in his tie and white coat and me standing next to him? The majority of the time, I'm going to get more attention.
Have you ever had any patients that really you could tell were kind of not necessarily hostile, but just weren't open to you at all because of how you look?
I won't say not open at all. I've had a couple, and I'm not picking on them, but it usually is older people. Yeah, and when I say older, older than me, probably over the age of 65, who are sometimes a little taken aback. You can tell when you first walk in the room. But one of the advantages that I think I have is I can read a room pretty well when I walk in, right? And you can read that. You can read that body language. You can read that vibe in the room. Sometimes you just got to take it for what it is, let it settle down, and see where you get. Most of the time, the reason why you're not connecting is not because of the way I look. There's something else going on. They're using that as a barrier. I've had patients who love me, family members who are like, "You're the one taking care of my mom?" And the mom says, "Yep, and I really like her." I've never gotten thrown out. I've never had anyone say, "I don't want her taking care of me. Please send someone else." So again, I think if you just wear it proudly, they'll eventually they're going to accept you.
Yeah.
I mean, I will say, I remember this was probably 7 or 8 years ago. I was kind of maybe looking for like a per diem spot. And I had a friend who worked at an urgent care that was like, "Oh man, we're looking for someone to pick up like 1 or 2 days a month." And I was like, "Oh, that'd be pretty easy, right?" And they said to me, "Hey, the doc owners are kind of particular." It was a little bit bougie. They were like, they're a little bit particular about how people look. And I said, "Oh, really? Like, what do you mean?" And it wasn't so much my hair, it was the tattoos. They were like, because she had tattoos also, and it was, I got to wear long sleeves at work. And I'm like, "Really?" And she's like, "Yeah." She's like, "As long as I wear my long sleeves, nobody cares." But for me, it was kind of like, nah, for me, it wasn't worth it. I was like, I'm not even going to bother because it wasn't worth my 1 or 2 days a week, 1 or 2 days a month. But that's the only time I have ever been told. I have never encountered anything.
Any advice for like maybe younger people who are in school and getting ready to start their career and they're struggling with this? Like, do I kind of hide who I am or embrace it like you? And I know every situation is different and you can't tell people what to do, but just your last thoughts or advice on that and what you think.
Yeah, I mean, I think, for lack of sounding like a cliche, you got to do you, right? Your tribe is going to find you. You're going to try and find them, but ultimately they're going to find you and you're going to be like, "Oh, I got my little tribe here." Trust me, the majority of my friends who I consider my friends at work don't look like me, but we are the best of friends. We get each other through the day. And the more open that you are, the better you're going to be at taking care of your patients, because you will spend so much energy, whether you know it or not. You're going to spend so much energy on, hiding that you're not going to be able to use that. That's energy you could be using on setting boundaries, number one. Number two, taking care of your patients. And if you're putting too much energy into just hiding or protecting everybody else from what really is you're not going to have the best time. It took me, and listen, I know it's hard. I think it took me a long time to get there, but when I finally realized it, it made me such a better clinician. Not knowledge wise. It just made me so much more comfortable in doing what I'm doing, not even just palliative.
Yeah. And you can't really, I don't think you could connect with other people if you're not being your authentic self. If you can't connect with your own self, how can you connect with other people?
People see that, right? Like patients, it's again, like reading the room. Patients read your genuineness. That's a hard word, but like the more genuine you are and you just let it all hang out, like they really appreciate that. It's like, wow.
Yeah, I understand. I can see the struggle if you're coming out of school, and we all remember that, desperate for your first job type thing, and you want to put your best foot forward and things. And so I can see the desire to try to cover yourself and fit that mold as much as possible to get hired. But I think what I hear you saying is that then what happens, right? You've covered yourself up to get this job. And so now you're either got to unveil yourself, later, or be your true self later and hope it goes over well, or you got to spend your whole energy the whole time in your career fighting it and trying to hide it and stuff. So, I mean, obviously, depending on what people's situations are, it's probably always best just to go to places and be your true self. And if they are accepting and open to it, then you probably know you found a great place, for you to land. Yeah.
Exactly.
Okay. Well, I love having you share your thoughts on that, because I think looks in society and things that are acceptable, ebb and flow throughout time always and things. But I do feel like we're coming to a point in time where more people can express themselves how they want and it'd be okay. And so I think it's important to talk about, especially for the younger people who are, struggling to find their identity, just to resonate with that. You got to always look professional and clean and all of that stuff, but professional can have a whole range of things, including like with natural hair for, people of color and stuff. I mean, that needs to become more acceptable as well, because your medical knowledge and how well you can take care of a patient doesn't really have anything to do with what your hair looks like, right?
100%. And again, it's like listening to you talk, I'm like, all right, I'm not like putting a tank top on with a mini skirt and running to work every day. But
right.
I can't, the choices I've made is I can't hide the fact that my head is shaved. I choose to have purple hair and I'm okay with that. But it was a gradual thing. I had a little bit of purple. I had a little bit more. My hair was a little bit longer. It got a little bit shorter. And the glasses are probably my newest addition. I have about 4 or 5 pairs of just funky, fun glasses, and it makes my day. And now, that's my thing. People, if I haven't seen someone in a while and they see me, I walk we have a brand new SICU, and I walked in there the other day and had on a new pair of glasses, and they're like, oh, Tracey's here. She has her new glasses on. For me, it makes my day, and it gives me something to talk about with people.
All right, Tracey. Well, thank you so much for joining us today. And I love all of that you had to share.
So my name is Joshua Lumsden. I'm a physician associate who works in Seattle, Washington in adult primary care with a focus in LGBT health and transgender care.
Why don't you tell us a little bit about what your style looked like when you applied to PA school, when you went through PA school, and kind of how it has evolved since then?
So I started getting tattoos about 23 years ago, which I guess dates me. And they were pretty modest at the time, but although even my first tattoo on my arm was like deliberately below my t-shirt line because I really wanted people to see it. And just sort of progressed over time. I think by the time I got to PA school, like my forearms were covered, but I didn't have anything else visible, so I could just cover with the shirt. I had stretched earlobes back then. I as you notice, like I don't have them right now. And
so that's like those discs?
The large discs that involve like the tapering and the stretching. And I actually had them surgically repaired when I was in PA school because I was afraid when I had this desire to work with like underserved patients that it would scare little old ladies. Oh. and they're also like getting kind of uneven as well. And so I got rid of them and had them paid like quite a bit of money to have them repaired. And then I got to, I finished PA school. I ended up getting to this internal medicine job in a large hospital, like kind of quasi-academic medical center. And in the beginning, I was a little bit conservative, but I think, something happened to my clothes one day. Like I spilled something on it and I had to like roll up my sleeves. And I asked my boss, I'm like, do you care? At the time we had like a no tattoo policy. He's like, I don't care. Just do what you want to do. And this was like probably 2016 or so.
Let me clarify before you move on. So when you interviewed for PA school, at that point, you could hide your tattoos with sleeves, which I assume you did when you interviewed, but your ears weren't but your ears weren't repaired at that point.
I think at that point, like I wasn't wearing any jewelry because they were still uneven, and so I interviewed without them in.
But people could probably tell.
Yeah, they didn't really say anything.
Yeah. But so no tattoos up here, no nose rings, nothing like that when you applied. Okay, yeah. And just curious, do you know of any PA students who've gotten accepted in PA school who have more visible tattoos or anything?
So I remember a PA from Alaska, and he actually had tattoos on his fingers at that time and was let in. So I think the school probably would have been fairly tolerant, although I didn't want to hurt my chances at the time. And then I look around at the current class, like at the University of Washington, because I do some lectures. And, there's a little bit more of that, although they're still kind of buttoned down and covering a lot of it.
Yeah.
Like that stretched ear jewelry is a little more. They might have like open, they have their like sleeves open and it's okay. So it's less of an issue than it was then.
And remind me when you went to PA school?
It was like 2014 to 2016.
Oh, okay. Okay, so you had that, and then as you started practicing and became a PA, tell us about the evolution of your style.
At that point, I continued to add some tattoos, and I got, more aggressive at covering my arms at that point. And I'd always really wanted visible tattoos. I was like, a neck tattoo was something I'd wanted since I was like early 20s or so. And that wasn't the first that was visible. I went to New York because I was going to the pandemic to help a friend. Like every month in New York City, I had a lot of downtime. So I decided I'd get some tattoos because I hear they're really good. Yeah. But I had this idea for like a half mandala on the back of my neck, and I took it to the artist, and he was like, that placement is not very good. Would you do a whole one on the back of your head? And I was like, yes. I just agreed. I just like, okay, wow. Yes, I wanted it. Why not? We'll just like let the cards fall what they may. I didn't even tell my partner that I was going to get it. I think he knew that I was going to get some tattoos. And, it was a big change. There was like this disc that's like this big on the back of my head. Then what happened, I went back to work, was expecting some sort of like question or reaction. I think I actually like texted it to my boss at the time. Like, I did this. And she's like, you're kidding. And I'm like, no, I really did this. And I got to work, and no negative comments at all. Like, no one really cared. Yeah. It was just positive the whole time. Yeah. And, I was getting stopped at that point. I was like, wow, that's really kind of an interesting tattoo. I like it. So I was like very, very quickly, maybe even a month later, I got like this large flower on the side of my neck. Yeah. And I'm just like, let's see what happens. Nothing at all. Nothing at all. And so over the next like 3 or 4 years, I just gradually added, and I did like the rest of my head. I did, I got the other side of my neck done with this ship. I got like this mandala pattern right here to sort of go with what was on the back of the head. Yeah. I actually asked him to cheat it up on the jaw. So these like little ridges right here, sort of like are this extension of the mandala. And again, no problems. And then added the piercings back in that I had when I was younger.
So you have, just so people, they can't see, you have a stud in both noses, and then both nostrils, and then the ring.
And I keep them subtle more for personal preference. I'm not like afraid of something bigger, but it's just the way I like them. Yeah. And then like when I did this side of my head right here, I was ready to go onto my face. So I just asked him to extend this floral design along the side and like just creep on there. And again, no issue. And then most recently, a month ago on a trip to the UK, I found a facial artist and actually had him do this large kind of liney piece right there. And it actually extends over an old tattoo that I had because I didn't care for it very much. And after that, I had like these 2 lines done like a month ago. Yeah. Done my hands. I'm running out of room visually.
Am I seeing dots on your eyelids?
Yes, there are dots on my eyelids right now as well. Yeah. They're like 4 little dots. And interestingly at work, it has never, hardly ever posed any problem.
Like when you say at work, are you working is it an outpatient clinic? Is it a private practice? Is it owned by a big medical group?
So it's an outpatient adult internal medicine clinic. It is kind of in this luxury mall in a very, very liberal part of Seattle. Oh, okay. But, we have this wide range of types of patients.
Let's talk about the patients. Let's talk about the little ladies. Are you scaring them away, or are they down with it?
So I have had only 2 patients ever comment like somewhat negatively on this, and I'll get into that in a sec. But like I get like 80 like patients that don't know me compliment me literally every day on the tattoos. They're just like, they're beautiful. I really like them. Like 85-year-old women will compliment my tattoos and they like them. So I don't have many problems with them.
Yeah, that's why we're talking about this, because I think I know in medicine, it's always been, a thing about your appearance. And even for like front desk staff and things, they wouldn't hire people that had visible tattoos, and things had to be covered. But things are changing in society. People are getting more visual with their tattoos and different piercings. And so they may feel like they want to work in medicine, but they don't feel like there's a place for them. So that's, why we're talking about it. So it's interesting to hear the reception you get from patients. And also, I would expect to have a lot of problems with administration. Like on my 50th birthday, I wanted to kind of dye my hair blue. I had really short hair at the time, and I've always wanted to have blue hair. And I got it tinted lightly, but I was afraid to do anything more. And I was working locums. I mean, they wouldn't have that was no big deal if they didn't like it
at that point.
Yeah, but I was so afraid to do it because of what I thought the feedback was going to be. So that's cool to hear that.
If you had asked me to get all of this at once at the beginning, I would have been pretty uncomfortable.
Yeah.
Because I'd be very afraid I could lose my job or something. And and I think in some places it's possible.
Right.
I suspect that if I worked in like a conservative area, it might be very different.
Right. Yeah, definitely. We're not advocating to go ahead and change your whole looks and everything's going to be fine.
Oh, just do it. It's a good idea. Change your look. Because look at this. It's good. It's really good. But the other thing I was going to say is that, I actually see this unique appearance. I know of 2 other medical providers in the world who are this tattooed. Actually 3 now, but it's really, really uncommon. But my patients, especially with that focus on like LGBT care or transgender, a lot of my kids are quite impoverished and they're scared of medicine. They've been trampled on by physicians and other medical providers before, and they have a lot of distrust, and we have earned that. And by looking like this, I've had many patients tell me, I feel safe talking to you about what I need. They're able to tell me something that they might not tell other medical providers. I can do that preventative work or help them with anything they have. So I think it's actually an asset.
Yeah, definitely. Just like any of the groups like PAs for Latino Health or whatever, they're trying to get more representation in medicine so that our workforce reflects the patients that we see, because people are just naturally more comfortable and drawn to people that are similar to them, I think. And so we need to have all kinds of people practicing medicine to reach others. So in addition to practicing medicine, as a PA, you are also pretty involved in PA leadership and organization. So tell us a little bit about that and what's any feedback there.
So I am currently president-elect. I'll start my term in about a month, but it functions like a vice president for the Washington Academy of Physician Assistants. And then I also represent them for the 2nd year in a row in the AAPA House of Delegates. And I think, especially in the context of like the body art that I have, it's also an asset because I stand out. Like people remember me and I have something important to say. And I've testified on like gender affirming care and retiree membership and anything else because you put a nickel in me and talk. But I've testified on these things and people kind of remember that and it stands out a little bit. I have had people come up to me this year that saw me last year and they like remember me and they want to say hi or they just approach and ask about it. So and I think that's kind of had me stand out a bit with the students that I do a lot of like mentorship to. Yeah. So it's inspired them to get involved in WAPA. So I think it's good.
So I assume, like you said, you have to talk to legislators and things like that, sometimes different politicians. Have you noticed any kind of apprehension from them or anything?
So I've done work locally and nationally, both in DC through AAP, and then like when we got our bills passed in Washington this year.
Good work, by the way.
Thank you very much. It was a collaborative practice and the PA Compact, like 1-2 punch.
Awesome.
But I went to offices probably about like of a half dozen people. I went to the bill signings. The governor was there, and none of them say anything. Yeah. And maybe it's just they're being polite and don't want to. Yeah. Because it is a little rude to comment on people's.
Well, yeah, but I mean,
I'm not offended.
But you didn't see any like overt body language that like they were, horrified or put off or anything like that?
Never. I did have this like one patient and he was like 85 and had dementia. And he came in to the urgent care that I was doing extra shift in. And he looks at my arm and he's like, what's that shit on your arm?
It's a great thing about dementia. They're going to say whatever they're...
I can say shit on this thing, right?
Yeah.
Okay, good. So he was like, what's that shit on your arm? And I look at him and I point to a mole and I'm like, what's that shit on your arm? And he just laughed. And I was like, why are you here? And there was no other problem. And then I had like one other guy give me like the side eye and I could tell because his eyes are like going up and down. And he's like, where'd you go to medical school? And I was like, the University of Washington. And what are you here for? And then it was fine.
Yeah.
And you just have to be like polite and project confidence and also be competent. And it tends to overcome all of the problems.
Yeah, because people, they just want somebody that's going to be able to take care of them, really, when it boils down to. I'm always curious, are there workplace rules that you've come across? Like, is it in writing? Because I would think some places have it in writing about your appearance. Have you seen that?
And there are. And this is kind of common, although nationally your tattoo and body modification trends are relaxing. So I've looked at this very, very carefully in my own attempts to advocate for this at work. Our work policy was pretty liberalized kind of about 3 or 4 years ago, slightly before I got it. And it was not the main deciding factor, but it sure loosen the belt a little bit.
Right.
Previously, it was like nothing visible. Now it's like tattoos are at the discretion of management. And I would never put anything with like scare patients or be obscene, and it's just not my taste.
Right.
And I also really do want to do a good job for my patients. I don't want like the Grim Reaper on my neck. And there was a case in Canada, in Vancouver, where a patient complained in emergency medicine because someone had a Grim Reaper tattoo on their, on their body somewhere. And yeah, that makes sense. I mean,
yeah, people are scared. They don't want to see things that remind them of death.
Exactly. And so that, yeah, I would be a little bit judicious with that respect. And I also, like I said before, I'd be careful about like piercings or something that would catch in machinery or like ruin your, like break your gloves or something like that.
Yeah. So it's good to check your written policies, check with HR if you're really concerned and you're thinking about doing something. So what advice, if any, would you give to people who want to express themselves with body art or anything like that?
Well, check your policies is very, very good advice. But on the other hand, like a lot of what you're thinking, and this is for everybody, not just healthcare providers, what you're thinking about, should I get this tattoo? Like, what are people going to think? Is my grandma going to roll over in her grave? Is my boss going to hate it? The only one who should give permission for what you look like is you. And so I should not ask for permission to do the things I want to do in my life if they're not hurting anybody.
Right.
I think that was a pretty empowering realization. I think it came right after that big head tattoo.
We only have one life, right? And if it makes you happy, then I think that people should express themselves, how they want. But I love having these conversations so that people know how to fit that in with their professional life. So the last thing I want to talk to you about is that you actually have a podcast, right, for PAs.
Yeah, who doesn't these days?
I know.
Don't let anyone do it. Hey, let us do it. So, but it's called the PA Playbook and focuses on physician assistant specific issues. I have a co-host, Eileen, and each month we just explore a different topic. So and I'll have a guest on, usually like some PA nationally that I can find or network with. And so I've covered things like rural health and the crisis that we're having. I've covered telemedicine. I did one on student leadership, and I've done one on like PA practice laws. We have more kind of in the works right now as well. So
yeah, and you just released one about the compact, right?
Yes.
That you helped bring about by your work in Washington and stuff, you and others in Washington. And I that compact is something I've thought we've needed for so long.
For you as a locums provider, that multi-state portability of your license just probably changes things.
Yeah, and with telehealth, we have so much issue kind of competing with nurse practitioners because of a lot of the laws. This is actually a law that's going to help us have a leg up a little bit, or at least be on some even playing field with being able to easily get licenses in other states. So thank you for your work. Tell us the name of the podcast again.
So the podcast is called the PA Playbook. It's on Spotify and Apple, so easy to find there. You can also look up on my social media if you want.
Great. Okay. Well, thank you so much for sharing with us. I really appreciate your time.
Absolutely. Happy to help.
Well, what did you think? Are you convinced? Does it change your mind about what a medical provider looks like? And if this is indeed something that is professional, tell me down below in the comment section. If you'd like to see more videos about practicing medicine, then watch these videos here. Thanks for joining me, and as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.